Okay, so this is something I'm sure you've all been waiting for, which is as Grad Connect is now closed and people are starting to get calls or might be getting emails and such, what can we do for interview? How can you make your interview the best you possibly can? Because this is your opportunity to sell yourself. Remember, if you get an interview, this means as far as the hospital is concerned, you've met all of their requirements for them to hire you. But so is everyone else who's interviewing. So you now need to make yourself stand out from everyone else who's interviewing. So what this is general tips. I cannot give you a how-to guide on 100% guaranteed pass your interview, but this is hopefully things that can help you be more prepared and ready to give the best interview that you can give. And interviews can come in a variety of different styles. You can have things like group interviews. In general, Grad Connect does tend to more have just the classic kind of panel interview. So generally you'll be sat down with a panel of 3 people, and often those 3 people will be someone like your grad coordinator, someone from HR, and then someone from like the area that you're applying. So in our situation, nursing. So it might be like a nurse specialist or a clinical educator or a NUM, but sort of someone from that clinical area. What to wear? It shouldn't need to be said, but I'm going to say it anyway. Like, no offensive slogans or pictures, nothing that's like torn, dirty, disheveled, grubby. Like, you're applying for a job, people. Look professional. That being said, dress smart, but it doesn't have to be corporate. If you don't have a suit, you don't need to go out and buy a suit. I wore black pants and a floral blouse because those were things I happened to have in my wardrobe. It's okay to wear colours, you don't have to be all neutral, you're not applying for an office job. It's okay to have some personality. Wear something that you feel comfortable and confident in. But when I say comfortable, I don't mean leggings and Ugg boots. Okay? You're applying for a professional job, but be comfortable. Show who you are. It's okay. The questions that you're going to be asked, very, very broadly speaking, these will be related to the selection criteria, but that can be really, really broad. So, like, for example, that selection criteria about clinical knowledge and evidence-based practice, basically they can ask you absolutely anything because that just relates to all of nursing practice. So, yeah, the questions are related to the selection criteria, but they can be very, very broad. Really important. The hospitals will tell you this as well, but I just want to reinforce it. Do not share the questions. Remember, guys, this is a competition, okay? And if you share those questions during the interviewing process, you are giving someone else a competitive advantage over you. You are reducing your chances of getting a job and you're improving someone else's. So do not share the questions during the interviewing process. You might be given some time to prepare, so some sites will give you like the questions 15 minutes before your interview. A lot don't. You might just get the questions as soon as you walk in there. So what can you prepare for? Well, the question you absolutely can prepare for is, why do you want to work here? Or something along those lines. So what I'd say for this is, first of all, like, sit down, plan out, write out an answer to that question. In that answer, you're going to want to refer to the values of that organisation and tie them into your nursing philosophy. You're going to want to talk about prac experiences. Now, if you've had a prac at that hospital, talk about that. But if you haven't had prac at that hospital, that's okay. The graduate programs I've got have not been at hospitals I've ever done prac placements at. But talk about people's, go like, hey, I've never done prac at this hospital, but speaking to other students at university, everyone speaks very, very highly of the support they received and the culture amongst the nurses, and that's something I want to be part of. Identify what is unique about the hospital and talk about it. So what I mean by this is, say for example, if I had applied for Charlie Gardner Hospital and someone said, why do you want to work here? It might be something like, during my nursing studies, I've developed a real passion for high quality care that focuses on ensuring that everyone has the same access to care and that care is evidence-based and safe. Because of that, when I look at the values of this hospital and the fact that they value integrity, teamwork, and respect, this means that this is a place that I want to work. I've done placements at this hospital, and in the different areas that I've done placements, I have found that all of the nurses have been incredibly supportive and willing to encourage me and help me grow in my nursing career. So that's something that I want to continue to be part of. It also is really interesting to me, the fact, interesting probably not the right word, I'm just kind of making this up off the top of my head at the moment, but the fact that Charlie's is also a magnet status hospital is really important to me, because I want to be part of an organization that values their nurses and where people want to work and have that kind of culture. That's very vague, but this is why I'm saying, like, write it down. Don't try and make it up on the spot. So write something down, figure it out. When I talk about your nursing philosophy, this is something that we covered more in midwifery than in nursing, but it's about going, what do you actually value as a nurse? Why are you a nurse? What is your approach to providing nursing care? And kind of write that out in a couple of sentences, and then figure out how that ties into that hospital's values. Make it up so it does fit the hospital values. As one grad coordinator once told me, he knows everyone's making it up when they're talking about this kind of thing, but at least you put the effort into researching and knowing what the hospital's values are. And practice, practice, practice this. So stand in front of someone else and practice saying it out loud. You are going to have some kind of clinical scenario question, but that being said, it may not necessarily be what you anticipate. So I know before I went into my first grad interview, a lot of what I got told is you're going to be asked about patient deterioration or medication safety. I didn't. They didn't even get brought up. I got asked about things like time management and risk management and things that I wasn't prepared for at all. So the other thing, though, to remember with this is it's never going to be something that is very area specific, that wouldn't be expected to be known on that kind of beginner graduate level. So what I mean by that is you're not going to go in there and be asked, you're looking after a patient in ICU and they're on a ventilator and they are currently on volumetric control, but your peak expiratory pressure is dropping. What would you do? You're not going to get asked something like that, but you might get asked, you've walked into your patient's room and your patient is breathless and unable to answer your questions. What would you do? So they're kind of going to be more that broad beginner, even in those clinical scenario questions. They're not going to be area specific, very, very finite detail of things that you're not necessarily going to know. But whatever clinical scenario question you get asked, these are the things that you're going to want to be including in your answers. So the fact, if you do get asked anything about deterioration or patient assessment or anything like that, use your doctor's ABCD acronym. Do not forget to mention the fact that you are going to escalate. That is really important. They do not want you as a graduate nurse to be going like, yes, I can do everything all by myself, because that doesn't make you a safe practitioner, and they want to know that you're safe. So what they want to know is that you know that you should be escalating concerns to your coordinator or the medical team or the senior RN team. Mention the fact that you are going to document whatever care that you've provided. These are easy interview mark if you get these kind of questions. And the fact that you would refer to hospital policy and procedures. So, I don't know. Say, for example, like you got asked a question about your patient has a piggy tail drain that is day 7. What should you do to manage that? Now, to be honest, I have no idea what I should do to manage a piggy tail drain on day 7. So if I got asked that question, I would have no idea how to specifically answer. But you might do things like going, I'm not familiar with piggy tail drains, so I would go and refer to the hospital policy, procedures, and nursing guidelines to understand what's expected of me in that scenario and to identify what skills are required. I would escalate to the shift coordinator that this was a procedure that I was unfamiliar with and discuss with her if someone from the senior RN team was available to help assist me with this the first time. If I've identified within the policy and procedure that managing this piggy tail drain is within my scope of practice, then I would proceed to manage this as per the policy and procedure, and I would ensure that I had documented all the care that I provided in the patient's progress notes. Now, I'm probably not going to get full marks because I've not actually said what to do with the piggy tail drain, but I'm going to get at least some marks for that interview question because I have identified some important things about that scenario, such as scope of practice, using policy, escalating, and documenting. I'm going to include a link down below for some questions from Deakin University. It's kind of like a worksheet they've kind of put up of lots of kind of different graduate questions. Now, none of those are directly related necessarily to questions you're going to be asked. They put in a lot of different kind of questions that you might be asked, but they're really good to practice so that you're aware of the kind of different styles of questions you might be asked. And it's really good, I would say, practice those in front of another person so that, because you're going to be answering these questions in front of another person, and sometimes you think you know something in your head, and once it comes out loud, you don't know it at all. What else? So, portfolio. Put together some sort of a portfolio, and I don't mean like the portfolio unit portfolio. I don't know if they've changed it, but I did not find it helpful at all when I did that unit. And different sites will want different things from you, and they'll let you know what they want from you. But what I would definitely recommend is having a file where you have copies of your prac reports, including your facilitator's comments. Can help you with Pebble Pad. That was after my days. If you have not taken copies of your NCAS books, or you've lost copies of your NCAS books, you need to contact your unit coordinator to organise to go into university to take copies of those. You need to make an appointment for them to pull your file, but you can do that. Also, you might want a copy of results. Again, some hospitals want these, other ones don't. You can either go into uni and get a formal copy from student services. You do have to pay for that. Or I just gave like a Sonia printout. Have a good question ready in your interview. And what I mean by a good question is, do not ask about something like pay, because you can find that out by looking up the Nurses Award. You get paid as a level 1 RN because that is what you are hired as. Don't ask about things like working hours. You should have asked about that before you applied for the job. Ask interesting questions. And by interesting questions, remember, these questions can be questions that you are asking the people conducting the interview. So it could be something like, what makes you most proud of working at this hospital? What challenges does this hospital face in providing care? What vision does this hospital have for what they would like to achieve in the next 12 months? I have a passion for Indigenous health. What is this hospital working towards to help improving Indigenous health and to close the gap in Indigenous health? Things that might generate conversation, that are interesting, that show that you have some, awareness of the hospital, or just an interest in the hospital and people. Like, you're going to get a mark for asking a question. Or at least you have in the past. But try and make it something interesting, something they may not have heard from like the last 20 people who have all gone, how much am I going to get paid? So try and make that an interesting question. Remember, during your interview, you can ask them to repeat the questions. You can also ask them to repeat back the answers that you've given. That might allow you to identify when you meant to say something and then forgot to say something, to make sure you've given all the information that you thought you wanted to give. You can also ask if you can take in pen and paper in order to write down your answers to keep track of what you're saying. They don't have to agree, but they might agree. It's always something you can ask. So, for all of those of you who do have interviews, all the best.